Thank you, Mr. Chairman. I also want to improve our healthcare system for Americans with chronic conditions. Unfortunately, Republicans are rejecting the chance to actually help patients by continuing the ACA tax credit. One of my constituents is self-employed and a caregiver to her husband. Through the ACA marketplace, her premium will already nearly $1,500 a month. She has a chronic disease and told my office she does not know what she will do if the premium goes up. Mr. Conley, is it true that expiring ACA credit could cause all insurance premiums to rise?
It is true that without the enhanced premium tax credit, almost everyone on the ACA exchanges will see some increase in their premiums. Some might be smaller, and some are as high as $1,500, $2,000 every single month.
Mr. Conley, we all know that chronic disease put a heavy financial strain on patients. Can you talk about how Republican proposals to repeal the ACA will affect people with chronic disease and disabilities?
Well, I'll say, I haven't seen any proposal. I think we hear in the news proposals around HSAs, health savings accounts, that have to be paired with high deductible plans and plans that have essentially the highest out-of-pocket that you can have on the exchanges, like a bronze plan, to have about $18,000 annual maximum out-of-pocket. The worst thing, if you have a condition like a blood cancer, is to be in a plan with a very high deductible and a very high maximum out-of-pocket. When that happens, folks see their bills quickly mount. Weeks later, the debt collectors call, and they, right out of the gate, threaten to put a lien on your house or threaten to garnish your wages, sometimes while you're in the hospital. This happens to blood cancer patients every single day. And so there's some care that actually requires you to pay up front. And like at a pharmacy counter, generally you have to pay before you get the med. And so there are also patients who will just be completely unable to access their care as a result of having those extraordinary out-of-pocket costs that are seemingly a part of that plan.
So, as you have just stated, and you have observed this particular situation that's occurring, what sense do you have, you telling us here, the members, Democrats and Republicans, what's your advice that you're telling us?
My advice is a two-part plan. It is to extend these tax credits today because we have 40 days left. There's not enough time to come up with a comprehensive plan to replace or even contemplate adjusting, really, the Affordable Care Act. It's a complicated system, and it requires thoughtful approach that would have been great earlier this year, but I think now we don't have that time on our hands. So I think we have to first extend the enhanced premium tax credits. Second, I will say in my written testimony, I think I have about $1 trillion worth of savings that actually is patient-friendly and lowers healthcare costs for everyone, not just folks on the exchanges, but folks in employer plans, folks in Medicare. We need to have a conversation around costs to bring everyone's costs down, and that will reduce everyone's premiums once we are able to have those folks not hanging in the balance because of the expiration of these tax credits.
I hate to put you on the spot again. Are you optimistic that someone will be listening to you?
You have to be optimistic. There's a lot of patients that I've met just this year. I've worked at Blood Cancer United for 11 years. I've met a lot of blood cancer patients. I've met a lot this year who rely on the premium tax credits, and some of them I'm sure watching now. They're definitely watching what Congress is doing, and they are afraid. And I think working on their behalf, we have to be optimistic.
Thank you, Mr. Chairman.
Thank you.